Welcome to the marvel of nature. Welcome to ultrasound scanning of the vertebral column and the central neuroaxis, as best seen in the age group of infants and taken up its ossification at all. And the central neuroaxis is totally open for the ultrasound beam to enter and reveal the neuroaxial conduit, as it were, to us. So, to begin with, we are going to show you how to hold the probe, which probe to use in the first place. We shall start with the linear probe, a very high frequency one. I am aware that smaller footprint probes such as hockey stick probes are available. However, we prefer to use this particular probe because it has a longer footprint and shows many vertebral bodies at the same time, or the spines at the to you. That the orientation marker here is towards the caudal end of the patient. It could be the other way around as well, as long as we are very mindful about where the orientation marker is. We can have an aided work where we can measure the distance, keep the probe aside, or we can have a guided work. If the well, this is how we go ahead up from the caudal end to the cephalad end. This is the tilt that I just showed you to look at the paramedian axis, which is hardly required in this age group. But still, we need to know that this can be done. In 1 year, 2 years old, yes, this coming to the transverse axis, we can actually palpate the sacral cornu or keep transversely on them and then go ahead higher up. So let me pause for a minute and read out the entire scan for you. As we just discussed, the orientation marker is towards the caudal end. So this is the caudal and that's the cephalad. So this is the skin and subcute, and understandably very, very little. Well, then we come to the posterior elements here, which are the spinous process of the sacrum itself. As discussed, these are not ossified and hence are not hindering the visualization of the structures anterior to it or beneath it. Then this is the phylum terminale, and these are the vertebral bodies of the sacrum. So this is the floor, this is the roof, this is the floor of the sacrum, and this is the content, and this is the CSF, and this is the posterior dura, and that's the anterior dura. Now let's slide the probe higher up and see what is revealed. As we start moving higher up, I'm going to pause and again show you what I want you to see. Skin and subcutaneous tissue, this could be the laminae because now they aren't rounded anymore. So this could be the laminae. Now this particular line, which is so very discrete, is the posterior dura. Once again, this is the anterior dura, and now these are the vertebral bodies. We are almost now in the lumbar area. Well, if you can see these hyperechoic structures in between, they are the resultant of the ultrasound beam hitting on the interface of the central end of the anterior commissure, and hence this can be very grossly called as central echogenic complex. So we go ahead from here. We are at the higher up now, and well, this is how it would be seen. I'm going to pause and show you that, look, this is another sac here. Can you see these two white lines, hyperechoic lines, merging into another conus as such? So yes, indeed, this is conus medullaris. Now let's read the longitudinal scan once again. Skin and subcutaneous tissue. These are the laminae, or could be spines, but laminae because they are a little longer. Spines would be circular structures. Okay, this is the ligamentum flavum, and this is the posterior dura or arachnoid dural layer bordering the spinal canal, because now this is conus medullaris. So this is the spinal canal. So this is the posterior dura arachnoid complex. This is the anterior complex, and the anterior complex also has the posterior aspect of the vertebral bodies, and this would be the ligamentum flavum. So this is the conus medullaris, as I told you. Let's ascend high up now. So this is the spinal cord pulsating very well. This is the spinal cord, dura, dura, vertebral bodies. The eyes of the frog, and this is the lip of the frog as such. So just going through the sacral corners at different levels, and we are ascending up. Once we ascend up, we start seeing the neural structures. So this is the phylum terminale in the cross section. Now we are going ahead. Now, if you really see what it is, this is the posterior and this is the anterior. This is the spine. These are the erector spinae, and this is the lamina or the arch of the vertebra as such. Now, this is the entire intrathecal or the spinal cord. So these are the elements of the nervous tissue, the neural tissue, and they become actually, or they are the dorsal and the ventral nerve roots. So let's go ahead and understand that this is the vertebral body. This is the anterior dura, and the posterior dura would be somewhere here. Let's go ahead. Now this is higher up. This is a proper pulsating intrathecal space or the spinal cord. These are the neural tissues in it. These are the nerve roots which have come out. This is the anterior complex. Here is the posterior complex. This is the lamina, and these are the ventral nerve roots, and these are the dorsal nerve roots here. Understand the space, and you will start seeing what you have to see. These are all the nerve roots which are getting out of the spinal cord. This is the lung, so we are already in the thoracic place. This is the spinal cord, the nerve roots emitting out. And it's not that we can't see it, but it's the angle of the probe that has given the illusion of absence. So this is the spinal cord once again. And you can even, if you carefully look at the scan, you can even see the dentate ligament, which is hardly ever seen in adults.